Good evening, uh, and thanks for coming for this lecture. My name is Ahmed Radwan. I'm fourth-year resident here at SIU Psychiatry, and we're going to talk today about one of an interesting upcoming field in our training here or everywhere else, which is the sports psychiatry. What is sports psychiatry? I'd like to think about it as other fellowship we have or subspecialty in psychiatry. So we have child psychiatry, we have geriatric psychiatry, we have other field. It is mainly you are categorize your patients in a group that has a specific things. Like for example, with geriatric and child psychiatry, it's the age, right? Below 18 and above 60 or 65. Same with addiction, you are doing with mental health in specific, mental illness in specific. Or it can be a setting like consultation liaison CL. So you are doing it in the hospital with liaison of other people. So in sports psychiatry, it is for a specific population that share that they all rotate about something, which is the sport. It's like the reproductive psychiatry about the woman mental health. So it involved delivering psychiatric care for athletes, for coaches, and even for journalists who are involving with the sport. With going more in the era of social media and stuff like that, we're going to talk about that later on. But first, let me do the disclosure that I have no financial relationship and I will not discuss any off-label medication. And I will use these presentations with Sports Psychiatry Fellowship with International Society for Sports Psychiatry. And at the end, we should be able to explain many things like what is the correlation between psychiatry and sport, and also how we can provide psychiatric care for athletes, in addition, like how we are impacting the life of the athletes. And lastly, we are going to talk about some challenges case. I would like to hear from you how you are going to deal with it, and also some challenges that might happen in the future of this field. So we talked about what is sports psychiatry, why we have a sports psychiatry, why we don't have physicians psychiatry or psychiatry. I like to think about it as, let's talk about us. We are all physicians in this room. Where did we start our career? What age?
Getting into med school, or
Yeah, beginning of med school.
use most people?
Right. So between 18 or 22 or 24, right? And what is your age? What is your peak? What is the peak of your performance as a physician?
Haven't even begun to be.
10 years, in my opinion. I don't know.
45.
You are the peak of working hours.
Well, no, no.
What's my peak intelligence?
You can say like the peak is attending life, maybe, right? So most of the people, it's between 30 and what is our retirement age? 65. Can you work beyond that?
Yes, absolutely.
Absolutely, that's right. So basically, our lifespan is basically the same lifespan of the normal human being. Let's say about athletes. When did they start their career?
Extreme.
5.
Right? They start pretty young. Roger Federer, the famous tennis player, he said, if you hold the racket after 12, you're done. You're not a tennis player anymore. My cousins, they were in tennis national team for Syria in Davis Cup, and they started holding the racket at the age of 6. Well, 6. So you are responsible when you are 6 years old. What kind of skills do you have when you were 6 years old? Stress, how do you deal with all children? Exactly. And what years are your peak?
Yeah, mid-20s, late 20s.
Like late teens, early 20s.
Yeah, mostly it's between 24 and 30, like for all the sports I know. And then after 30, you are approaching.
Yeah.
And then retirement is what, 35?
In the late thirties, yeah.
Can you-
Depends on the sport.
Can you after that?
You could, but I wouldn't
You
recommend.
you gotta be like a superstar at that point. Like LeBron James.
Right.
Yeah.
Michael Phelps go over.
Exactly.
That's 30.
Yeah. So, all five, now 40s, but no more than that. After that, you start to
Yeah.
get arthritis, right? Other stuff. So their lifespan is starting pretty young, pretty early, and they ended up their career pretty young. And they have all the stressful and the requirement stuff to do. And they don't have the experience. They are 35, they are retiring. How do you deal with retirement? It's a stressful moment by itself in almost all the world, but maybe here. So that's why sports psychiatry, we have a sport psychiatry, because these specific employees, or they have, we're gonna talk about that in the upcoming slides, but they have specifications for their mental health. So how does depression appears in athletes? You know, with depression, it happens in different way, even in our life. When we were kids, it's different than when you are in your 20s, in your 30s, and in elderly, it's more like irritability, right? The issue with athletes is it can be masked. Like, if you ask your patients, what do you do for fun? They're gonna cite one of the sport. These people do sport already. This is their life. So anhedonia might not be there. Energy might not be there. Weight gain, appetite go ups or down might not be there. So diagnosing them with depression might be very hard. It's there, it's available. There are a lot of athletes, we'll talk about that in a second, but there are a lot of athletes that they do have depression. But the issue is how to diagnose them. And other specifications about sports psychiatry is what is almost the always available criteria on all the mental health. You always find it letter E or the last one. Exactly, the functionality. What is functionality? It used to be the axis 5 in the DSM-4, axis 1, 2, 3, and 4, and 5, the last one. And it's measured subjectively because we don't have like what is functionality between all of us, it's different. In sport, they are required to do beyond human being, right? They are required to perform very highly, and even they compete with themselves. There's only one winner. All the others are losers, right? Even the second one. So, or the runner-up. So how do you determine their functionality that it's impacting or not? The best thing is to do a collateral information and also try to elicit the somatic symptoms of depression, like sleep-wise, like energy, like appetite. These kind of things, they are all like almost there with people. Who's this guy? Right. Michael Phillips is very, his conditions is very classic, very specific. He is considered the best Olympians among all time. I think he was born in Baltimore, and he competed in 5 Olympics, starting from 2000 in Athens, and he ended up his career in 2016 in Rio de Janeiro. You can count his medals. He scored more than 25 gold medals. I remember in London in right in 2012, you know, at the end of the Olympics, they ranked the countries. So United States always the first, China, Russia. He by himself number 7. By himself, he scored number 7 among like in the beating countries, more than 200 countries by himself. After 2012, after he scored all of that, he was number 7. He openly talked about what he said is post-Olympic depression. like, okay, what I'm gonna do right now. I am on the top. So anything beyond that is I'm losing. How can I maintain my performance? What's next for me? People remind me for 1 month, and then what's next? He even talked about that post-Olympic depressions that led for DUI. He got a DUI because of that, and he openly talked about that. I actually listened for one of his. He has an organization that advocates for mental health, and one of his presentations was in Qatar, I think in 2016. So I listened for his presentations for 1 year, and it was very significant. Like he almost advocates for mental health better than any other athletes, in my opinion. But what an amazing guy to. Who's this lady? And Serena Williams is considered among top 2 best sport tennis women, 23 Grand Slam titles. Anyone watch King Richard? The movie? Yeah. You know, when Will Smith slapped that guy in the Oscar, he won the Oscar because of the King Richard. He talked about how he raised both girls he had, Serena and Venus, and how he was the one who covered them and defend them from all the media and marketing that they were trying to make girls 10 years and 12 years old sign the contract. And even her life was stressful. So she was number 1 and her sister was number 2. And when they reached the final, there's one winner. And the media kept saying that the rich are the father who decide. Today is you, tomorrow is you. A lot of stress. She's a very strong lady. This picture, I choose this picture among others because she won Australian Open and she was pregnant. So she didn't say I'm pregnant until she held the trophy. She was pregnant.
I remember.
Remember that?
Yeah.
I think she was on her 15 weeks or 20 weeks, something like that. But what a strong performance. She talked about her depression that started because of the media and also because how the community perceived her and always required from her. She had an incident when she was holding a glass and then the glass broken in her hand, and that caused her to be away of tennis for 6 months. And if you are away of tennis from 6 months, your ranking goes behind very significantly. So that's also put a huge pressure on her to gain the performance. She had a documentary. She talked about that. I haven't watched the documentary, but it's there if anyone is interested. Next, we'll talk about anxiety, most common illnesses and mental illness and prevalence-wise. It can also present in athletes in different ways. Performance anxiety, anxiety from injury. What if I get injury? Anxiety about you are passing your prime time, but you are not scoring. Basically, you are doing sport all of your life, and it's not rewarding you with money or rewarding you with trophies. What's next? Some people, some athletes, and most of them, they cannot do school and sport. So, what is next from them? Also, part of anxiety is the social anxiety. What if you have social anxiety and you have to perform your top level in the front of 40,000, one watching you on live and 2 million watching you on TV, and anything you can do, it's on the camera. So this is also a huge amount of social anxiety. Who's this lady?
She's a new star.
Samuel Saito. She was cited as the next Serena Williams. She was born in 1997 from Japan, but she lived most of her life here. She won U.S. Open against Serena Williams, against her idol in Flushing Meadows in New York. in one of the most controversial match ever, where Serena Williams was disqualified from the match of the final in front of her supporter because she got pre-warned. And then the supporter, because she disqualified, then they pay a lot of money for watching a match that is, eliminated. So they started to boo her. And she got the US Open, but she was crying from her sad. And Serena Williams stepped and helped her celebrate it. And then she won 2 Australian Open, and she was on her prime. Like, I personally thought she's gonna be exceeding Serena Williams. What happened is in 2021, after the COVID, she refused to go for the press conferences. In tennis, you play 7 matches for the Grand Slam, and before the match, you have a press conference. Directly before the match, you have a press conference or like a talk with the reporter, and after the match, you have a press conference. So 3 by 7, it's 20. It's too much. She said, it's not helping me with my mental illness. I'm starting to get more anxiety, panic attack from coming here. It's not a comfort zone, so I'm not gonna go to the press conference. And the French Open said it's mandatory for you to go. So first time we are going to fine you. Second time we are going to double the fine, and third one you are disqualified. And she disqualified from the tournament. And then after that, she decided to shift her life. She got a baby, and just in January this year, 2024, she back to play tennis, but she, of course, like past 3 years of her peak performance because of anxiety disorder. This is one of the press conference that she was forced to go, and you can see even the reporter, they were taking that opportunity not like to watch how they are asking the questions, but they got that opportunity to, hey, we can have something in the first page of the journal. She has a Netflix documentary about that as well. You know this guy, I will do something good for you. Party Fish. He's not very well known in tennis, but he has the best documentary in Netflix about anxiety disorder and how it can affect. Like, this is the one I highly recommend if you are watching one thing. In the prime era of the United States tennis, Pete Sampras and Andre Agassi were there. And then they retired, and Andy Roddick came along with Marty Fish. But Marty Fish was always on the behind Andy Roddick. Till 2011, when he exceeded Andy Roddick by hard work. He was living in Miami, doing all the work, keep improving his strokes. He beat Andy many times, and then he beat the Federer, Nadal, Djokovic, the top 3. And he started to win matches. And then the light started to point it toward him. He couldn't tolerate that amount of pressure. On the match, he got a panic attack. He couldn't tolerate that. And then after a few months of that panic attack, he announced retirement. And now he's the coach of tennis national team, Davis Cup. He's the coach. But yeah, I highly recommend. He was the first Netflix documentary that talking about mental health. Marty Fish. PTSD in athletes. Also, I like to think about that title in specific, like athletes with PTSD. Because what is the treatment for PTSD? Therapy. What kind of therapy? Trauma process therapy, right? And the trauma process therapy, you have stages. Stage 1, 2, 3, and 4. The last stage is the trauma happened, and now it's the time to deal with it in a healthy way. And how to deal with it in a healthy way? We use the defense mechanism called sublimation. Right? What's sublimation? You have negative feeling, you shift it to a positive feeling. Like someone has cancer, this is in step 2, it was good. Someone has cancer, make charity for cancer. So negative to positive. So one of the things that common use as sublimation is sport. So by definition, the athletes might have from the beginning some kind of trauma. They are trying to cope with it by going extreme or something, which is a sport. And other way, athletes might suffer from PTSD as everyone have. Do you know is this guy just playing tennis last day?
Say, let's Kobe, but
I honestly forgot his name. I'm not good with basketball, but he was one of the top players that Kobe Bryant gets affected, and he helped Kobe Bryant in Los Angeles Lakers in the beginning. Now he's a coach. He authored a book and he talked about his life as a basketball. In 2007, during the peak time of the NBA tournament, the knocking round, he got some people go inside his home and they pointed a gun against him and they talked about his money and like they threatened his kids. So he said he had PTSD and that was one of the things that accelerated his retirement. So also, even if you are an athlete on the top level, things like that can happen. Eating disorder. Eating disorder, it can happen commonly. The peak of the prevalence of eating disorder is between 15 and 20. What if you are an athlete and all the media is taking your photos and you are on the front page of Boy and other? What if you are a gymnast? Yeah.
There have to not have any straps showing or
You need
you're wear
a
basically
body
a
like
bathing
body,
suit.
right? So all of that also influence your the eating disorder and how it can happen. Other thing is some people like to do the behaviors of eating disorder because it's a self-punishment. If you are participating in a competition and you lost, after that I blame myself, so I'm gonna I'm gonna make myself hungry. So it's like a negative circle, but it gets rewarded because you are doing something to punish yourself. It's your friend.
Files.
She also she's cited as the GOAT, the greatest of all time of gymnastics, and she has an outstanding performance both in Olympics and in the World Association. What happened is in 2020, when it's the time of Olympics in Tokyo, and because of the COVID, they decided to shift it to 2020. She was practicing very hard for this Olympic, and now the exam. Imagine if yourself, I told you tomorrow is the exam, you prepare for the exam, and then I told you I'm gonna postpone it till 1 year. So you have to keep restudy again, everything. And they work very hard to beat some kind of fraction of the seconds. So they have to do all of that again. In addition to the questions mark about having the Olympics or not. It was till like end of 2020 till they say we're gonna have the Olympics in Tokyo and we're gonna cancel it. So she was saying, I'm gonna go, I'm not gonna go, and then she couldn't tolerate all that pressure, and she said, okay, I'm not gonna go. And word that a champion like her is gonna miss a big opportunity. She talked also, she's authored a book, and she talked about how she got a lot of eating behaviors stuff, and how the media was punishing her for getting extra muscles here or her body is changing, and also how she decided to do self-acceptance and promote mental health with in the community. Substance use disorder in athletes, and this is a big topic because first it's people use substance most of the time because they have something and they're trying to self-medicate instead of following the right approach. And the stigma is available for mental health all over the world. What if you are an athlete? you are competing in high level, and now you're saying, I have depression and anxiety. How are you going to be perceived? So instead of getting the care, substance use is there. What else? It can improve your performance. It can make you sleepless. It can make you, this fraction of seconds we talked about, it can make you last longer. Other thing is here in substance use disorder and athletes, there are organizations that they have by itself a complaint. What is okay and what is not okay? Like for example, even with the cannabis here in the United States, federally it's illegal, but in some states it is legal. So if someone is prescribed marijuana here in Illinois and he goes to participate in Olympics in Tokyo, is that okay? Or they have it in their system?
That's what it's like.
Shakira Jackson, isn't Shakira the one who was, that's exactly what happened with that.
Let's think about the grinding.
The what now?
Brittany Grinder. She for having the opinion.
Was it Russia?
Oh, yeah.
Right.
That will
Yeah,
say
yeah.
that's right.
Maria Sharapova,
Yeah.
she was taking medications for her heart.
Mhm.
She said, I have a condition that causes me heart attack. I said, these medications cause you to have methamphetamine. And all these things is organized by WADA, which is the World Anti-Doping Association in Montreal in Canada. They keep upgrading their law. And if they take a sample from you, they freeze it for like decades. Maybe they're gonna have some kind of research and technique. They're gonna reveal stuff from the past.
They take metals from nothing. Like they go back.
Yeah, they go back. They go back and they took some metals from the athletes in the past. So with the pressure of cannabis and now it's acceptable, they finally make a statement that during the competition itself, you are not allowed to use cannabis. However, if you are not competing, you're okay to use cannabis. But how are they going to decide when did you use cannabis? I don't know.
Yeah.
If cannabis stay in urine for 28 days is 2 months.
Is the hair more accurate? The hair test?
I think the hair lasts the most, but I'm not sure if it's more accurate. It's for up to 1 year. But I don't know if they measure something in there.
Yeah, if they can tell when you did it from the hair, I'm not sure.
They could just in the sense of like how far from the molecule it is.
Yeah. I'm thinking.
So,
What if someone volunteer and
yeah, right, what if they just shave their?
Like, you shake your head and
so it is really controversial what is okay and what is not okay. Other thing is we're gonna talk about that in ADHD section. What if you are really have conditions that require you to use medication? Anxiety disorder, first line treatment is not controlled medications, not benzodiazepine. So if you have anxiety and you say I'm using benzodiazepine, then but what if you have ADHD and you are using methamphetamine? This is the gold first line treatment, gold standard. So we talk about that in that section, but it is a controversy with the substance use disorder. And other thing is, what is the best treatment for substance use? Therapy and rehab, right? Who is going to take months to do rehabs from their peak performance? It's hard, right? They have already a limit time to compete, so it can be hard. With this guy.
oh, what's his name again?
So nobody was born in the 80s. This is Diego Armando Maradona.
Oh.
And yeah, Maradona was my idol when I was a kid. They have a photo for me, 5 years old, screaming Maradona, like my son now do with the Spider-Man. But this guy is a true, not a fiction or an Avengers. He is cited as the greatest of all time in a very competitive sport like soccer. he by himself carried Argentina to won the 1986 World Cup in Mexico with amazing individual performance. They were kicking him, but by himself, he scored the best goal in the history against England, and then he scored a goal by his hand.
Yeah, no one saw it.
No one saw it, but then they told him it was against England. So we talk about England later on in the slides about, and how they like the soccer. So they were very angry and they called him cheater. He said, "I'm not cheating. It's not my hand. It's the hand of God."
Yeah.
This goes viral till now. Like I don't say it's not my hand. It's the hand of God. He won the World Cup in 1986, and then they told him, "You are competing in a short tournament, like 1 month. So you are not the best." He said, "Okay, I'm gonna go and compete in Italy and in the leagues, 38 games, and I'm gonna go with a team that is underdog in the middle tier." He went to Napoli, and he by himself, of course, with the other help, but he won the league twice. He was the god of football at that time. Everyone was dreaming of just watching him train. The turning point of him is in 1990, he did the World Cup in Italy, where he played for Napoli and he was the fan favorite, and Argentina played against Italy. So now he has a conflict of interest. He played in Argentina and he scored a goal against Italy, and then the fan turned against him and they started to boo him. And he said, "Oh, I did everything and you guys booing me." So he left Napoli, he left Italy, he went here and there, and then his performance started from. What happened? What is the reason for? So this picture here is when he won the 1989. The other picture actually that happened in 1994. Who hosts the World Cup in 1994? America, United States. And as you all aware, it's not like a good or fans like it here it's not popular. So they wanted to make it popular in America. We want to market. So they assigned an organizations for that, and that organizations think that American likes superheroes. They like names. They like Michael Jordan, Shaquille O'Neal. They like Pele. We need Maradona. They went to convince Maradona to play in Argentina, and they found him very weak. And even couldn't stand up. They told him, "We want you to play in America and in the World Cup." He said, "No way, I cannot do it. I cannot burn my history." At the end, they convinced him, and they told him, "You are going to go for 6 months in a rehab in Cuba, and you are going to use some kind of innovative medications, stuff like that, techniques. So you're gonna be Maradona 1986 again, like superhero, like Avengers, really." And he got promises that it's not gonna be revealed anytime. He went to the World Cup. See his picture here with the nurse. He's like the 1986. Same, that they reshaped him. First game they won 4-0. Second game again, first game against Nigeria they won 3-0, and then second game against Greece in Boston they won 4-0. He was very happy with his performance. The nurse came to take him for anti-doping test, and he was smiling. You know it's gonna be positive, but he was smiling. Why? He was thought they're gonna take it.
Oh.
So he was promised, "We are going to protect you."
Nothing. From
Yes.
Cuba.
So he was promised, "We are going to protect you." And the nurse came and he thought it's going to be prearranged stuff. They're going to tell him it's just for the media or marketing, stuff like that. And unfortunately, they betrayed him. It became positive. And this is his photo. Cannot explain himself after the positive result. That was the ending of his career.
Market is bad.
Yeah, it was a good story. Yeah, it was a good story. So they won, he lost. And after that, he relapsed again in cocaine and he passed away in 2021 with heart disease. He was 60 years old. from how much Argentina loved him, they took a picture with him while he's dead. And of course, they sued his physician and all of that. ADHD in athletes, it's more common, more prevalence in athletes comparing to the normal population. Hence, what is required from them is much what is required from the general population. So if you have ADHD in athletes, you are not going to listen for your coach and apply the techniques. The coaches there have 5 minutes. You see them in basketball, and then you go on. With ADHD, you cannot do that. Also, it happens in early age. Like if you are getting more tasks to do in your school year, you might be diagnosed with ADHD more than if your school is like normal pace. So they are required to do above the human nature when they were kids. So their chance of getting ADHD is higher. And again, what is the gold standard treatment for ADHD? Stimulant, which is going to be positive in the urine bloodstream. So how to avoid all of that?
Can they not have a doctor's note? There's no like doctor's note that I'm prescribed ADHD medication, but here's my testing, I really do have it.
Or if you
A
put
lot
that,
of them will fake it.
Yeah.
They make fake
then will, every language is fine, the doctor will make that thing else.
That's true.
Yeah, the thing about ADHD, and you're gonna see that in your clinic here, people think if you are lifting 100 pounds, you take Adderall, you're gonna lift 300 pounds. It's not like that. If you are lifting 100 pounds, it's gonna make you lift 110. Of course, not like lifting, but performance-wise. So in athletes, that matter. The pounds matter, right? But in normal being, it doesn't matter. So what, as a physician or a psychiatrist, can do is do more comprehensive history, neuropsych eval. There are other stuff that you can do, scales, and there is one computer program. It's expensive, but it can diagnose ADHD and very accurate. You can do all of that and then discuss with your with the patient. Hey, I'm going to give you this medication. It's going to cause that. The best thing to do is while you are prescribing the medications, the patient use that time to improve their performance in non-pharmacological way. There are CBT, for example, specified for ADHD. And I came to know from the last, from one of the exams that I had recently, that there is a video game, that is FDA approved to treat ADHD. It's called Endnover. So there are stuff other than medications. And if that is going to be an issue, there are non-steroidal medications that can be used. But if it's going to come in the urine, it's not a barrier for you to prescribe again methamphetamine.
Oh, that's Russell Westbrook.
Yes, that's one. I have some Lakers. So he openly talked about his ADHD. He spoke about it, and he said how he was, when he was a basketball player, he was accused of not following the coach's instruction, and that caused him to be on the bench many times. But it's all coming from ADHD, and after he got the treatment, performance improved because he was able to register information and all of that. Sleep in athletes. It's important because if you're not sleeping, you're not gonna have good energy, but at the same time, sometimes they make the matches late at night for marketing, for Asian to see the match. Like with the US Open 2 years ago in the tennis, there were a match that started 12 past midnight and ended at 5 a.m. Why? Because that match is gonna have high watching count on Asian. It's very relevant in sports like tennis, because in tennis you are living in an airplane and in a hotel. You keep traveling from a city to a city. You don't have a town, you don't have a home, and it's at the end of the year. So that is gonna mess with the circadian rhythm. This treatment is sleep hygiene and other stuff, although some athletes talked about them taking Zolpidem, like Murdyfish, the guy I talked about. Your friend, Sheffield?
Yes, Shaquille.
Different gyms.
Yeah.
That's King James.
Together.
This is- He talked about how insomnia can affect the performance and how he by himself struggled with insomnia. And he was pushed for more schedule system and also to avoid training late training and how people like to improve their performance by staying awake with training and delay their sleep. Novak Djokovic is the GOAT of tennis. He got 24 Grand Slam titles. This is his last Grand Slam title last year in New York. He's very well known for his own approach of not taking any medications. He was one of the athletes that refused to get the COVID shot. And because of that, he couldn't go and he denied entry for United States and Australia, and he missed the competition there. And he refused to take the COVID vaccine. What happened is because of the traveling, he also have some kind of sleep circadian problem. And he talked about it, and he talked how they are asking him to take medications, but he refused, and he was able to deal with it, especially after he's now, I think, 37 or 38, after the age of 30, by doing meditations and mindfulness, which was very helpful for him. And also, he started to cut the amount of tournament he's using. So now he's having home, he go for 1 week and he come back. Not like going from tournament to tournament. This is, I believe, is going to be the most issue in the upcoming years, bullying in athletes. Why I'm saying that? Because when I was a kid and I watched sport, if my favorite player missed a penalty or did something wrong in the field, it's for 1 day, 2 days, we are talking about him and he's not listening for us, and then it's over. Now with the cyber bullying, it's there forever. AI can make photos for anyone. So the bullying is tremendous. And what's the skills again athletes have to deal with bullying?
It's really bad. I still remember a couple of years ago, one of the Cameroonian soccer player lost the penalty kick. They actually burned his house down in Cameroon. Yeah, that's how bad. And Cameroon didn't qualify for the World Cup. So imagine, like, you know, it's really bad. Like, you lose a penalty, you're screwed. Right?
That's a aggressive way. In 1994, in the World Cup of America again,
Uh-huh.
there was one Colombian defender who scored a goal against on goal.
Uh-huh.
And then Narcos in Colombia, they killed him
They killed
when he
him.
came back. Yeah, Narcos, they killed him.
And sports is no joke, especially soccer.
It's really life threatening.
Sometimes they even burn their parents' home.
Straight up violence.
Turn off your.
How many incidents we have like that? 2, 3, 4, 5, 6. But cyberbullying, it's every day. Like the only deal with it is you turn off your social media. And social media is the main source of income for the athletes nowadays. They even get their salary from the social media. So it is really, really an important issue to address. And how to deal with it is hard because they lack the skills. One of the striking incident that happened, Rashford, right? There's two players here in Manchester United and one in Arsenal. Saka from the top right, from the right, then Sancho, and then Rashford. This is the story about England national soccer team. As you know, the soccer started from England. They were the one who innovate the soccer. And every tournament they go and participate, their theme is, we are going to bring it back. However, they're not good with tournament, unfortunately. The last World Cup they won in 1966. And the last Euro, which is like the continental itself tournament, won, I think, in 1980s. So in 2020, they will have a strong team and they host the Euro. And these three top players, they were on fire. They reached the final stage, and it was played in Wembley, the most important or the most famous soccer stadium in the world. They play against Italy, who is very well known for being defenders. The match reached for the penalty kick. You shoot 5 penalty kicks each team. So the England, they choose 5 players, 2 white and 3 colored. Scored, and these 3 colored, they missed. The of the national soccer team or the logo is the 3 lions. The amount of bullying happens to these 3 people were very shocking to hear in 2021, especially after the COVID, after we see how the humanity is suffering. There was one photo that they replace the 3 lions on the logo with, I don't want to say the animal, but they replaced it. So seeing that was really, really shocking for me. I hate sports.
Oh,
You
I watched the match.
you was not? Yeah.
I remember that actually. Watch soccer, but I remember that. Sorry, football.
Yes.
It's like such an isolated incident in sports. What are the chances that all the 3 black people are shot?
Yeah.
I'm bad for that.
And the one who think about replacing lions with, I mean,
Yeah.
how bad you are, like only thinking about that. I don't know.
A lot of free time apparently.
In Europe, it's not uncommon though. They used to throw banana peels and stuff at some black players when they score goals. Even Samuel if you had to face that a couple of times.
Samuel Eto'o, Daniel Alves,
Yeah.
Vinicius nowadays. But yeah, that was very huge, and it kept for 1 week almost till some people say, okay, it's enough, and Instagram intervene and delete all these photos. Medication is used for psychiatric disorder in athletes. When you are dealing with athletes, most of us think about dealing with top elite. The fact that I'm looking now for a job to like part-time job to work with athletes, you're going to work mostly with high school, beginning of their career, people who are highly competitive to pursue their training and sport. And initially they are struggling with something or others, so you deal with that. So I like to say 3 words about how to deal with athletes, and it should be done with, honestly, with all the field of psychiatry with any patient. Comprehensive, 360 and tailored, like these 3 things. For example, tailored wise means if you are seeing patients here with athletes, you don't prescribe medications that make them, if possible. You try to do psychotherapy most because psychotherapy is stuck in the long run, right? And you try to do motivation interview because motivation interview helps with going from a stage to another stage. These kind of things that is helpful when you are dealing with athletes. Other than that, they are same patient, physicians, relationship. They are the same. But they have some specifications. We'll talk about them in a bit. Yeah, and we talked about ethical issues in sports psychiatry. I'll keep that for one of the case. All right. Challenge case 1. You are treating a football player at a Division 1 university for generalized anxiety disorder and alcohol use disorder. You are aware that it's common knowledge among the football player that internal drug testing happens on Monday afternoon. He recently admits to having been using a friend's methylphenidate to help with studying. He's aware of NCAA prohibitions against this in the absence of an official diagnosis and appropriate documentation. He asks if you are able to make that diagnosis, as he believes it is there, And in the meantime, he asked about the half-life of methylphenidate so that he can avoid testing positive on Monday afternoon. Kind of some thoughts you guys have. First, are you going to tell him what is the half-life of methylphenidate? So no.
Google it.
So, yeah,
It's Googleable, so.
yeah, it can be revealed and it's not harm. You're not prescribing anything, right? It's not your intention to tell him to take it Tuesday because it's going to be done on Friday. But
So what day of the week is this, you know? Is it Sunday?
who knows?
Thursday?
But at the same time, you want to build the therapeutic alliance, so you need these kind of informations to be delivered in order to gain the patient's trust and build the therapeutic alliance. What kind of things? Oh, you make the diagnosis of ADHD? No, right? It's obvious. But what kind of things you have in your mind? What kind of things you can help the patients with?
But I will try to see if, like, what kind of symptoms are you having difficulty that he needs them at the date. So like, we could start the process of, like, understanding what's happening. Maybe with your child, like, I mean, if he qualifies for.
Talk to him about it's gonna take more than just one appointment of getting to know you before I would make that diagnosis, but if he, try to leave room for the chance that it is the attention is a serious problem that he is dealing with and that he's not just saying that to get out of the protest. I'd also try to address the attention in other ways and, assess him for sleeping issues, assess him for any sort of depression or anything else that could be affecting his attention. Because those would be other things that'd probably be good to rule out before just delivering an ADHD diagnosis.
Yeah, I like these thoughts. As we said in substance use disorder, why people use substance. Exactly. So medicate themselves for what? The patient is currently at your door. If he left, he might not come back, right? These things might end up his career. So you use this time to do comprehensive eval, see if you can help him in another way. You already have generalizing nervous disorder. As you said, it can affect his performance. And you can provide psychoeducation for him. Tell him, mental health can do so and so. If they say if they find it in your body, then the consequences. So let's work together to help you with finding the best treatment for you. So again, he's on your door, don't let him go out easily. That's kind of the things that we can do. Yeah, good job. What is the half-life of methylphenidate, by the way?
I think. I think it's pretty quick. I don't know.
Most ADHD.
Yeah, I think the shorter, the only common drugs that is shorter than that is cocaine. That's why people like use it because it disappear in 1.5 to 3 days. So then it will just 4 to 5 days. So we should use it on Monday only.
After Monday, you're playing with fire, buddy. Just looking out for his best interests.
Yeah. Then you are treating a sprinter at Division I University for a panic disorder and NDD. She wins the NCAA National Championship 100-meter dash. She would like to give you her track jersey to add to your office decor as a token of her appreciation. She observed that you have some generic sports decoration, but nothing related to track and field. and it would make her feel good to have her sport represented in new walls. She points out that nothing on the jersey will indicate from whom it came. What to do? Here's my jersey.
It's too personal.
Hmm?
It's personal. I would not accept it. I think she might think something else. Don't have any other people's jersey or something.
But you have other stuff.
Let's generate a thing. So I might generate a thing for straight thing.
What do you guys think? Accept it.
Why'd you ask me this? I don't know. No.
He could tell you were stressed.
I'm back and forth. I'm off of it. I mean, to be quite honest, and I don't know how.
When you accept gifts from a patient, what two things you come?
You have to do it way like their intention, if there's a chance that they're doing it because they want something.
Okay, so like you cannot accept things outside of the normal billing stuff, right?
Mhm.
And the other thing is, and especially related. Hmm? No, it's-
Value.
Hmm?
The value, like the monetary value of the item.
that comes with the first one. But the second thing is confidentiality. So you are mandated to protect the patient's confidentiality in all the means, direct or indirect. So if you find, I don't know, like her jersey and the doctor office, that might reveal, right, something. That might reveal something that she was here, although it doesn't have her name, but one of the team was here. And then you can narrow it down to 3 person, stuff like that.
Even if it had like a year on it from whenever that championship happened, plus the number, then you can look it up and find it online. You could,
Yeah, you can find it. Or it can bring attentions that this team is struggling and they're not scoring because someone was listening, right? I don't know. There are a lot of conspiracy here. But at the same time, how do you say no for her?
I would love to, but by law, I'm not able to take that jersey. However, I appreciate the sentiment.
With that smile, I'll take it.
Yeah.
it's very thoughtful, but for the, like your privacy, I would say it would be better.
What about divert that intentions to something acceptable? Like she wants to feel happy, right? And you want to help her with feeling that way, but at the same time, you want to build the therapeutic alliance again. What if you say, well, thank you so much again, what you said exactly, but what about donating that to the charity to help with cancers that can sell it, and then they can use this money to build a hospital? It's better than having it behind your desk, right?
Buy Division I university jerseys.
I honestly don't know what is Division One.
College,
Oh, okay.
like football, ones that get televised.
People buy it, yeah.
You could also offer to address her other concern about not having any track and field decorations. I mean, that's something easy to fix. So, I agree with you. Field decorations.
But I
But
think
just
your
not-
jersey would be better at this organization for people who are learning to run.
Exactly, exactly. So try to divert, and you're gonna see that in the clinic here. Gonna bring you some kind of money or something like that. I don't know what is the threshold of acceptance. I know there's some $150 or something like that, but I don't know.
So you could take it as less than one.
Yes, but I don't know the number. I don't know the amount.
That's 50.
Like, what if a patient bring you a bottle of wine on the Christmas?
Take that.
You did. But it has to have some value. I don't know with
How do you find the other wine in the office if you're in the wine?
I don't know. Ask the front.
Medical school, they never accepted any gifts that their patients brought them, but they gave them to all of the staff.
Yeah.
So, like, they had a lot of patients come in, just like, oh, all Polish people bringing in bottles of vodka. And these nice Indian doctors who don't drink alcohol, they're like, oh, you're Polish, here you go.
That's fine.
They would accept, but say, I'm gonna share this with the staff.
That's good. But you have to let the patient know.
Yeah.
So she gives you the wine and then she finds with someone else. Same with taking photos with athletes. Like, this is something that gonna hurt me the most if I work in sport. I like to take photos with athletes. I travel for. But maybe I'm gonna think about, I don't know if it's ethical or not, but what if you have a photo with Nadal or Djokovic and someone say he's having mental illness? And Ahmed Radwan, the psychiatrist. So.
I mean, you don't have to share that with anybody. I think that's the other part of this. A lot of times we talk too much, and this is the pot calling the kettle black. A lot of times people do way too much online. Like, I don't see a problem with you taking a picture with somebody if you're not going to share it with the whole world. Put it on your social
If
media.
your phone gets hacked,
Are you gonna post?
See you on the lives.
Do Polaroids, so then they're like your personal.
Or is someone breaking it down? What is someone breaking it down?
with your patients, that's. I don't even think we should be taking Polaroids with our patients. You saying like if you go to a soccer game and you just happen to see the soccer player and you're not treating them? You know, because if you're not treating them, I think do whatever you want.
But what if Michael Jordan walks into your
I
office?
just.
Well, I mean, you have a good story to tell people.
They're not gonna believe it. They need evidence.
Care what people believe or don't believe.
You can't accept jersey. You can't accept the wine. You cannot take photo. Then you take on
Point.
Yeah.
Should be regular about it.
Let's do the case 3.
Okay.
This is the last slide. So you are a salarized employee in athletic department at Division 1 University, employed to treat student athletes. You are treating a female softball player for recurrent MDD, PTSD, and borderline personality disorder. She has had 3 hospitalizations in the last 18 months. Has proven disruptive to her team. The athlete's trainer and coach contact you to ask about prognosis and likelihood of future decompensation and hospitalization, as they are considering cutting her from the team due to her mental health absence. What do you think?
Dad can't comment about that because 1, it's not my patient and I haven't met them, and 2, even if it was, it would breach confidentiality.
And what kind of things you can breach confidentiality for?
Thing that you know about the patient.
Sorry.
You're saying which ones
Self,
can
Right,
breach
self,
confidentiality? Yeah, just harm to self or others, basically.
Yeah, or forensic report, you don't have confidential. But otherwise, you are remain to have the confidential. So, yeah, you're right. Exactly the same patient as coming to your clinic. You need release of information, not disclose. But what if, let's say that she gives you the release of information and the coach asks you what is the prognosis and likelihood of future decompensation and hospitalization? She had 3 in the last 18 months.
I'm like, that's a serious best given to the person that you are talking about. Simple as that.
You as a physician can provide prognosis.
Just not to them.
Why? She signed the use of
And a chronic increased suicide risk.
Hmm?
She's got a chronic increased risk.
Okay.
with management outpatient, we manage. Kind of kept at bay without exacerbation.
Or they have
Or,
See,
like that too, but I would be like, there are so many factors that involve at me giving you an estimate at her future, like position or not, so can't give you an exact what she's going to do, whatever, based on these.
I like all of these ideas. You're gonna get questions about prognosis also in your career. So the way I like to say, if anyone asks me about prognosis, is first I give general prognosis about the disease, and then I give a specific diagnosis. What is prognosis when when we are saying prognosis? Prognosis is a balance between good factor and bad factor, right? Like for example, with borderline personality disorder, we say the prognosis, the good factors for good prognosis is following up with mental health, no self-harm behaviors, no addictions, no substance use, less hospitalizations, and also good coping skills. The bad factors, they are either age, female, and the other substance use, access to guns, previous suicide attempts. So you get general idea about what's going on. And then you say specifically for this patient or for this, she has 3 hospitalization recently, and she has self-harm behaviors. Yeah, and also she has PTSD and MDD. So these things make the prognosis worse in the short term. However, she is an athlete, so she has good coping skills. She has a career, she has support she needs, she's caring, she comes to all of her appointments. So that's make her prognosis good. So you didn't give an answer, but you kept it for the judgment of them. So you don't say fire her or give her time. You just give an idea and they're gonna pass. They are the judge. That's the way of talking about prognosis.
basically, this is the condition, these are the risk factors, these are kind of what we can control. And this is what's specific for this patient.
And these things can improve the prognosis. But for her, if
Yeah.
she does therapy every week, if the intensity of training is less, if she comes to the clinic every time, if she takes her medications, all of that makes the prognosis better. Okay. What question?